Welcome back to another episode of Your Body Speaks. I'm Dr. Brook, your host, and I am so excited to share with you today a gentleman by the name of John who practices faith-inspired craniosacral fascial therapy. Now, if you are a patient of mine, you will understand that some of the stuff that I do is fascia related, but this guy does fascia to the 10th degree. And he trusts in the body's ability to heal as God intended, which I totally love. He's formerly a critical care nurse, but now practices hands-on therapy that supports physical and emotional well-being. Super important, while honoring the great physician. Through Midcoast Fascial Therapy, he offers care that reflects his experience and calling to serve others through faith-inspired cranial fascial therapy. John, welcome to the show. So excited you're
Yeah,
here
thanks for having
today.
me.
Yes, 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 yes. So, all that to say, I want to hear from the critical care nurse side of things to jumping into
Sure.
what you're doing today with the fascial work. What happened in between there?
Yeah, no, I was a critical care nurse for, over a decade and always felt like, it was the right place. Like when you're in an accident or you're having a heart attack or a stroke, like you need medicine, you need surgery. So I felt like I was still helping people. Sometimes in the hospitals, in the medical world, we kind of overdo it. But I felt in the critical care environment, like at least I'm doing something, but I still always felt like this.
Mm.
We're missing the holistic picture, right? We're missing the alternative stuff. Um, and then I stepped away from nursing at the bedside in October of 2021. And I did some like home care kind of on the side, doing some care management and stuff. And my youngest son has, tethered oral tissues, and
Okay.
we were looking for ways to kind of support kind of the tension in his body. And
Hmm.
my wife found CFT or craniosacral fascial therapy. And we started looking for somebody in the area. And at the time, there was one woman in Massachusetts, and she had like a 3 month waiting list. So I looked up and I said, I'll just go take the training. As a critical care nurse, I think I got the brains for this. I can figure it out. So I went down to Pennsylvania. That's where the class was that year. And I took the 3 day foundations course. And day one, I just knew right away, like, all right, this is it. This is the thing. Like, this is what's been missing. And it felt so natural. It just kind of came to me. Um, and I was seeing these like real root cause healings going on, like people dealing with these chronic issues like, GERD and migraines and
Hmm.
emotional
Yeah.
traumas, which after
Yes.
I came home, and said, I'm going to turn this into a business. The home care agency I was working with had to lay me off. They couldn't financially support the position. So I said, okay, God, I'll start my business. Message received. And I didn't look back. I knew there was a need for it in New England. Like I said, there was just me and that one other woman at the time.
Yes.
So I knew there was a need. And I realized pretty quickly that like Maine's huge, but New England's even bigger, and the United States is bigger than that. So I was going to have to travel. So then I
Yes.
started traveling around New England, kind of bringing this therapy to different parts of New England that needed it. I've been to Canada. So that's kind of the arc, right? From critical care to where I am now. And there's no
Mhm.
going back. Like what I've seen happen on the table is just beyond, the testimony is unreal. Miracles happen, and I've witnessed them.
Mm.
And um, yeah, it's really seeing like the body do what the body's designed to do, right? Like we can have issues and we can give you medications or we can do different things, but sometimes that's just putting a lid on a boiling pot, right? The water's still
Yeah.
boiling underneath.
Yeah.
With this therapy, we're seeing the heat get turned down, the boiling stop, and people actually have true healing. And when you start addressing root cause, the 9 other things that are being, the issues seem to just disappear. So it's been a
Yeah.
lot of fun to just kind of see that happen and really leaning into that, like the body knows best, which is something I've always kind of preached out to the world that like you were designed in a way to find balance and your body knows exactly what to do. The problem is we
Amen.
get impatient or we
Yeah.
try to get in the way.
Yeah.
So when you step back and you yield and you surrender to it, your
Yep.
body will do exactly what it needs to do. You might not like it, you might not enjoy the way through it, but you are going to end up exactly where you're supposed to be, and it's going to be better than any pill, surgery. It's really remarkable when the body does what the body knows how to do.
Oh, preach, 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 preach. So amazing because it's something I really like, stand up on my platform and really talk about all the time is the body is far wiser than any doctor, scientist, anybody can even imagine. God gave it
Hmm.
that intelligence. And, I know I go out on a limb sometimes and say this, but I truly, Jesus was the greatest gift that God gave humanity. Second to that was these bodies that he placed our soul inside of. And he's given them to us, like to carry our soul through this world. And we have to learn to like take care of it and honor it and not try to hack it. A lot of our wellness culture today is like hack, 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 do, do, do. And you're
Absolutely.
talking about something that's really just unraveling pieces, not even putting so much input into the body or putting all these different things into it, but unraveling so it can do what it's been designed to do all along. So, in plain English, for those people who might be going,
Hmm.
what is fascia or what is he talking about
Sure, sure.
fascia? Like, how would you define the word fascia for people?
So here's what I tell people. Fascia is an all-encompassing, uninterrupted piece of body tissue
Mm,
that wraps around every muscle, bone, organ, ligament, blood cell, down to the nucleus.
yep.
But when I say it's uninterrupted, I mean like it's one big piece, right? It's kind of like imagine a suit underneath your skin,
Yeah.
and it weaves through every body system. So it makes it
Yeah.
the biggest body system. The same fascia that wraps around your brain stem, that wraps around your cardiac muscle or your heart muscle, is the same fascia that wraps around your shins, that wraps around your big toes. It's the same piece of tissue. So the analogy I give is if you start twisting a shirt or you start twisting like a pant leg, you're going to see wrinkles. That's your fascia. So you can see how restrictions in a shoulder start to pull across the body into the back of the head, maybe down into a hip. So what I like to tell people is where there's strain, there's not always pain, right? You can complain of shoulder pain, hip pain, back pain, but the issue could be in your jaw, it could be in your
Yeah.
feet, it could be in an ankle because it's all connected. So restrictions in one spot put pressure on the rest of the body. Now, I'm not, saying that tension is bad. Our bodies are built on a tensegrity model. Think of a
Yes.
suspension bridge. So the right amount of tension in the right spot, and we're able to walk upright and do the things we can do.
Hmm.
The problem is too much tension in one spot, and now everything's kind of out of whack, right? And then
Yeah.
we have to compensate. So as we release tension, the body shifts, finds where to put stuff in that new open space, and starts to put the tension back where it belongs.
Oh, so beautiful. Such a beautiful explanation of that. So, one of the questions I did want to ask you is how does clearing fascial disturbances and smoothing it out, so to speak,
Mhm.
how does that help downshift the nervous system? We hear a lot about in that wellness culture. You can go on Instagram and look at any twist and turn, and somebody's talking to you about cortisol or they're talking to you about
Sure.
GLP-1s and all these things, but it's like there's so many other things that can be done to help really regulate the nervous system. How does fascia help downshift that nervous system?
Yeah, so it's simple as this, right? Fascia is all encompassing, uninterrupted, so it's wrapped around your nervous system, right? Your brain,
Hmm.
your skull, all your nerves, right? It's wrapped
Yep.
around all of that. Well, it exerts up to 2,000 pounds of force. So if you start putting restrictions in that fascia, it exerts up to 2,000 pounds of force on your nervous system. So if you have 2,000 pounds squeezing down on your brain or on your brain stem or anywhere along your spinal cord, that's your craniosacral system,
Yep.
then it's going to put pressure back on the system. So as we relieve tension and stress in the fascia out in the body, it starts to take that pressure off of the central nervous system. Again, like opening things up and allowing
Yeah.
for more flow of, cerebral spinal fluid,
Right.
which nourishes and detox the body. But it's as simple as just imagining, one of your nerves being clamped down with 2,000 pounds of force. And if we can take that force off, clearly you're gonna be in better shape.
Amen. Have you seen then doing some CFT work with patients that cortisol comes back into balance, that fight flight activity like just, starts to come back into more of that rest and digest parasympathetic nervous system activity?
Yeah, no, absolutely. It's hard to see like cortisol without labs and stuff. And when I've had people that have had labs done, and
Hmm.
it's a snapshot. It's a picture of what's
Absolutely.
going on in your
Yeah.
body at that exact moment. Same thing with imaging.
Exactly what I
I
say.
don't I don't trust it that much. And even as a
Yeah.
critical care nurse, like I look for trends. So
Yeah.
I don't know if you come get a session, you go get your blood work and your cortisol dropped. I can't claim it. I'll say, yeah,
Yeah.
probably, maybe.
Yeah.
But as far as pulling people out of fight or flight, 100%. I've seen
Yeah.
people come in full on panic attacks and within the hour, 2 hour session, completely switch into, parasympathetic. I've seen
Mm,
people, fall asleep and
yeah.
clearly go into like beta wave and, really restorative sleep on the table. And I
Yeah.
accredit a lot of that to that craniosacral part of the therapy. I say the
Mm-hmm.
fascial part's really where we're going to get in and we're going to mix stuff up. It's very active. And then when it comes to the craniosacral, which is kind of blended in there, but I always tend to end with it because I find it's a good reset.
Mm-hmm.
That craniosacral work really just
Mm-hmm.
calms everything down. It kind of shuts you off, allows your body again to do what your body knows how to do with all that space and all that release you just got. And then
Yep.
you kind of come back online, like shutting off a computer at the end of the session, and you're in this new state, and then you hold on to it.
Yeah, so good. So good. Um, okay, so one of the other questions about your work, because I'm sure you've heard lot of myths around fascia work or,
Sure.
craniosacral. What is some of the common myths that you would love to retire about those things, craniosacral and fascia?
I mean, I've heard so many different things. A lot of people think that craniosacral work lives in like this new agey Gnostic place.
Right.
And I'll argue that like it can. I know practitioners that that's where they put it, but I'm a testament of it. Somebody who walked through that new age without even knowing it, and then was redeemed by the blood of Christ and saved, and
Mm-hmm.
completely had my eyes open to this therapy that I'm doing. I remember
Yeah.
sitting in the car, when I received it and said, can I still do what I'm doing? Like, I'll stop now, God. I swear I'll stop now. And I
Yeah.
opened the Bible. It was very clear that hands on healing is something that's very biblical.
Mm-hmm.
Jesus was a hands on healer. Um, so it really comes down to where are you pulling those intentions? I
Mm-hmm.
don't ever claim to have this mystical power that's given to me by creatures of the stars. I know that when I sit down at this table, I'm being, yielding these hands to God and
Yeah.
becoming a resource of his healing, a
Yeah.
reflection of his light, and being a conduit of what he can do. And there's only
Right.
so much that, I'm able to kind of do on the table, but there's always prayer involved and asking him to kind of do what he can do and what only he
Mm-hmm.
can do, and we send it all to his feet to be retired. So I definitely think that that's one thing a lot of people seem to think is that, any type of hands-on healing, especially craniosacral work, kind of borders into this weird, like Gnostic-y new age thing. And it certainly can, but this is where discernment comes in and really meeting
Yeah.
with the practitioner and finding out like what their background is. When
Absolutely.
before I was a faith inspired practitioner, I had people that reached out and said, hey, do you do all these things? And at the time I was like, yeah, absolutely. Divine energy, and we channel that white light. And I think back and it's funny because I can laugh about it, right? I don't have to be ashamed because I'm a new
Yeah.
person.
Yeah.
But I see now that like what they were asking and why it's so important, because I do the same thing now. I,
Right.
I discern everybody who puts hands on me or my family or enters into my home, because it's
Absolutely.
real and we have to, right? It's in the Bible that we're supposed to test the spirits. So
Absolutely.
I think that's the biggest one I think I'd want to lay to bed. And then the other thing is just that like it's all the same, right? Like if you've gone to one CST practitioner or one fascial practitioner that like you've tried it and it's over, CFT specifically, craniosacral fascial therapy, I mean, there are so many different people doing this and incorporating it into what they do. Some people are bringing pediatric PT to their table.
Hmm.
Some people have a speech pathology background, they bring it in.
Hmm.
There's chiropractors that are bringing it in. I have a critical care background, and I'm faith inspired. Like there's so
Hmm.
much that goes into the technique and the approach that if you tried it once, try it again, try it with somebody else, because it really can be different. We can't help but bring in our personal experiences to everything we do, especially when it's something we do
Yeah.
with our hands.
Yes. Oh, so good. So, so good. Oh, that's so amazing. I want to transition a little bit because some of the things that I work with on my patient or with my patients, I share with them, you can be without physical pain, but there could still be spiritual, emotional, and mental brokenness that has to be
100%.
addressed. So health is really truly a facet of all four pillars, standing straight and strong and, no
Mhm.
cracks, no nothing. And so I do deal with, patients who are coming to me with all different sorts of, situations, and there are emotional components that need to be unraveled. And I know that fascia like stores a lot of the emotions, like get caught
Sure.
in that, which could cause some of that what you were talking about, that tension, that pulling, that wrinkle in the
Yeah.
shirt. How have you seen emotions play a role in your work that you do?
Yeah. So it's the way it's almost like an alarm system, right? So the example I like to give, because it's easy, is a car accident. If you get
Hmm.
into a car accident, say you're rear-ended,
Hmm.
right? You kind of get that hit. You might get a concussion, you might get a headache. It could be really bad, or you might walk away from it.
Yeah.
But your fascia is going to remember that, and it's going to remember everything about that. It's going to remember the weather, the day, the time of the year, maybe the song that was on the radio, the smells, the sounds, everything, because your fascia is a super protective piece of tissue. So then
Yeah.
what happens is you're like, I'm fine, no big deal, but you can't seem to shake the stuck shoulders, or I always get these headaches and I can't seem to figure it out. It's your body remembering. It's your body sounding the alarm saying, hey, we're going to get rear-ended again and we need to lock up. And
Mm-hmm.
these are the people that have the shoulders rolled forward. They have tons of
Mm-hmm.
headaches, or things seem to be fine. But then, I don't know, every year, kind of around October, I start getting, the back sore again, and it takes like a month for it to shake out. It's the body going back to that period of time where the accident was. And now you
Yeah.
can fill in anything else, right? It can be,
Yeah.
as severe as abuse, or it can be as minor as like you trip and twist an ankle. The body's going to remember everything about it, and it's going to sound off those alarms. What I like to take is that this fascial therapy that I do is we go in and we calm that body down. We remind it that it's no longer in that period of time.
Mm-hmm.
We're gonna silence those alarms, and you're gonna see that you kind of start to build resilience in your nervous system, in your body, as opposed to reliance, right? Your body goes from having to do it to being, I know I can if I have to, but I no longer am in that state. And we
Right.
pull people out of these old postures and things like that. But like you were saying, it's not just physical, right?
Right.
We have a spirit, a soul, and a body. And the
Mm-hmm.
spirit needs to influence the soul, which should influence the body,
Mm-hmm.
right? It goes that way down. The mind is going to influence the body. So if we fill the mind with the spirit and truth and positivity, the mind will then manifest that in the body. So we
Yeah.
see things like anxiety, depression, self-defeating thoughts, and I like to call them broken thoughts, right? Like my
Mm-hmm.
body's a mess, or I'm
Yes.
just broken. And
Yeah.
what you're doing is you're telling your body's listening
Yeah.
to that because it can't tell
Yeah.
the difference between sarcasm, a joke, and you don't even have to say it out loud. If you think it, even
Yeah.
if it's a split second, for one
Yeah.
second, you go, oh, why am I so stupid? Your
Mm-hmm.
body hears that and it goes, well, okay. And now if
Yeah.
you do that over a long period of time, your body says, well, it's got to be true. So if I'm broken, then I'm going to break. If I can't do it, I'm not going to do it. And we see this with diagnosis. Somebody
Mm-hmm.
who just has, a few symptoms, and then they go and they find out it's being labeled X, Y, or Z. And then they all of a sudden somehow miraculously manifest, nine other symptoms of that thing. And it's like, it's because you believe it. You know what I mean? It's your mind has been told something, so then your body manifests it. So
Absolutely.
healing all three of those, we have to heal the spirit so that we can heal the soul, so that we can heal the body. The
Mm-hmm.
body, like you said before, it's a temple. It was given to us. And if you have the nicest temple and you spent tons of money building this beautiful building, but then
Mm-hmm.
you fill it with garbage, what good is it? And
Right.
vice versa. If you turn
Right.
around and you have, one of those Hollywood facades where it's just a bunch of plywood that looks like a nice house,
Yeah.
and you're filling it with the most expensive, natural, organic materials, it's
Yeah.
still trash.
Right.
They have to go together, right?
They have
You
to
have to heal
match.
the spirit, the soul, and the body. You
Yeah.
got to put the spirit in the temple because it just
Yeah.
otherwise it doesn't work. It's all three or none.
Yeah, absolutely. Oh, that is, yeah, it's so good. Whew, I had so much to say on that last piece, but it just kind of, it will come to me. God will bring it
Okay.
back. But going back to, because I know you got into this, in all that emotional component for sure, but going
Sure.
back to your son, in the tension in his mouth, his oral
Yeah.
tension, did you guys get that work through by, like, what was the outcome of all of that with, I know God used that to bring you into what you're doing
Sure.
now.
Yeah.
How did his story end?
He's doing good, right? So the
Okay.
tension, we can work on it. I
Yeah.
have since taken a myofunctional therapy course. I
Okay.
don't practice myofunctional
Yeah.
therapy because it's just too involved, but I'm able to
Uh-huh.
do all the exercises and things like
Yeah.
that, strengthen all his, oral motor, his neck,
Yeah.
his lips, his tongue, and all those things. And he's still happy and healthy. And I tell everyone,
Good.
just focus on that, right? Happy,
Yes.
healthy. When he
Yes.
was a baby, he gained weight, he
Yes.
nursed fine.
Yeah.
So really what it comes down to
Yeah.
is his airways okay? It
Yeah.
becomes a cosmetic, right? It becomes very
Right.
much an aesthetic thing at this
Mm-hmm.
point. He's got a nice wide palate, good spacing. So we're
Yeah.
not rushing to cut anything,
Mm-hmm.
but we will plan on, once he gets a little bit older, then we'll go forth with like the tongue tie release and the lip tie release, just because I know healing that and the stretches and things like that is going to be traumatic. Luckily
Yeah.
enough, I'm his dad and
Y-
I can help him kind of process that. But I don't need to put him through it right now at 5 years old. He can wait and he's
No.
doing okay.
Yeah, good. No, that's good
Yeah.
to hear. And Oh, that's the piece too. Like when you said it, I was like, I remember when you were talking about, the Hollywood facade or putting stuff on
Yeah.
the outside or not having the good stuff on the inside or how we kind of create to make it look like it is something when it's really not. And we do
Hmm.
live in a society, and unfortunately, it makes me very sad, where a lot of it is all of this external. Like, what does the skin look like? How many wrinkles do I have? Is this happening? Are my lips looking full enough? Are my breasts like where they need? Like all these things that we
Sure.
look at and we deem like that is a good sign of health, right? And when in reality, the whole entire inside is tight and taut and just like angry. Like I use terminology like your body is so angry. Like why is it so angry? We got to figure it out and unravel it from the inside, and figure out how to
Absolutely.
support it. So such a good point because yeah, I mean like that is like how like you were saying like emotions and the way we see ourselves and the way we think about ourselves and the way we talk to ourselves because I mean, this whole podcast is called Your Body Speaks. It truly does speak to us. It communicates to us all the time. The problem is we like go la 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 la. We can't hear you, or we want somebody else who's wearing a title, Doctor So and So, or a white jacket, or a magic
Hmm.
pill, a magic shot, something to correct our problems, rather than truly like going, well, what is it that you're asking for? What is it that you need? And for those of you who aren't looking or are viewing this on video, I'm pointing at myself, like, at my body, like, what is it that
Yeah.
you need? And so this society that we live in, just very quick to try to, like I said, like I was saying earlier, like this whole hacking culture too, where we just like want to just throw more at it, throw more at it, throw like
Yeah.
hoping it's going to function when really like less is so much more. And I think about like taking this back to scripture because I know like you and I share these beliefs, but it's like Jesus wasn't like even when he cast out demons and did healing and all the things, he wasn't using all these words. He wasn't doing all these things. He wasn't doing all kinds of crazy. He literally maybe picked up dirt out of the ground, spit on it and put it on somebody's eyes or just touched them or said,
Mm.
"Leave them now." But this society we feel like we have to say, it's got to be 50 words or more. It's got to be this
Right.
amount of concoctions or more. And so it's just like this like overdoing like and not enough of this just awe-inspiring like listening and really working on figuring out like what you're doing with patients and helping them unravel those pieces and get that tensegrity model to the
Right.
point of where it needs to be, not pulling one side or going like this or unraveling those stuck emotions and those memories. So I just want to like just on that point, I just want to say thank you for doing what you're doing and being another voice out there and, talking about it because it's important. So,
Yeah, no, you're very welcome. And you're right. We live in a society where people are impatient and they don't want to feel.
yeah, yeah,
And the biggest part of healing is you have to be an active participant. Nobody's going to do it for you. Not your chiropractor, not your fascial therapist, nobody. You have to do it. And you have
absolutely.
to feel it. It's going to be inconvenient, might be uncomfortable,
Yeah,
but if you want to get through it, you have to. So we're
yeah,
quick to, take a pill or look for the thing because we want to disassociate. We don't want to feel. We don't want to do any of the things that require true healing.
right, right.
Emotions stick harder and longer in the body. That's my opinion, because as we get older and adults, we learn to be hesitant, we learn to be afraid, we get
Yeah,
ashamed, and babies let it go, right? Babies will
right.
cry, they'll fart, they'll poop,
Yep,
they'll do all the things because they don't care. As we
yep.
get older, we get these emotional restrictions in our body and we're afraid. I don't want to feel that again, or that's uncomfortable, or
Hmm.
that reminds me of something from my past. And it just sits there and festers and gets tighter and tighter and just continues to like pull on everything else. So these emotional releases tend to be
Yeah,
really big, and as we're working, we hit no's in the body, right? Parts of those bodies where you're like, all right, that's not really moving. But I've learned to kind of sit on it, right? Because once that no kind of gets comfortable, we find out it's a hesitant no or it's a scared no, and the no becomes a
hmm,
yes. And we have these big releases. So
hmm.
emotional healing is huge too.
Yeah,
And like you were saying in the Bible, right? Jesus did all those wonderful things. And the one thing he did was he used his tongue. The power of
yeah,
life and death is in our
right.
tongue.
Yep,
So speech, right? How we talk
yep,
to ourselves, how we think about ourselves,
yep.
so important to the body, right? Jesus said, Lazarus, come out. He did. He said, get
Mm-hmm.
up and walk. He did. Jesus
Mm-hmm.
was using his tongue. He was using his voice. And we need to be
Amen.
more mindful of how we speak, because it really does carry the life of destruction, or it can rebuild, right? It can kill or it can bring life.
Yes,
Yeah.
so good. So good. I don't mean to make this be my show. I mean, it is my show, but I'm
It
having
is
you
your
on as
show.
a guest, but God pressed it on my heart last year to really help people anchor into their body in a whole new way through faith and
Sure.
not fear, because people fear
Yeah.
their bodies. And so the Talk to Me Body card deck is from different pieces of the body talking to the person. And when you said that about the tongue, that's, it's like, I am your tongue. I,
Mm.
can bless or I can curse. Use me wisely. And then I pulled this one specific for you. I don't know if you can see it. I am your
No, it's,
fascia. I
ah,
connect everything, holding your body's silent memories. I tighten when you hold back emotion. I soften when you release. I don't forget trauma, but I don't need to stay stuck in it either. I weave through muscle, bones, and organs, giving shape and structure and communication to your whole body. And then I put on here Proverbs 3:8. It will be health to your flesh and strength to your bones. But yeah, I want
mm.
people to understand their fascia is very, very important. So,
Yeah, I
yeah,
refer to it as God's yarn. You know what I mean? We were knit together in our mother's womb.
love
And I tell
it.
people, you were knit together with the fascia, right? It goes through every
Yes.
body system. And when you think of knitting, right, you knit with yarn, and yarn's usually made of wool.
Yes.
So, I mean, I really believe that we've been woven together with, the Lamb of God. From the very beginning, when God created us in our mother's womb, he gave us Jesus. He
Yes.
set us up for success, and he
Yes.
said, you'll need nothing, right? Just like Psalm
Yes.
23, you'll need nothing. I'm setting
Yes.
you up from the very beginning. Your body's going to be woven with Jesus, and he's going to be there with you from the time you're born to the time you die. So,
So true. Oh, so
yeah,
good. Okay. One more thing I want to ask you. In transitioning away from that, can you share with us like a success story or like a cool story in practice where maybe like the person came in, they were complaining about headaches, but you
sure.
started working at their foot or, something else like came up? Like, because a lot of times when I'm working with patients, what I see is people come with their like, the symptoms that they're consciously aware of, like, oh,
Yeah,
it
yeah.
hurts here or it icky, but then a lot of times the body's like, actually, this is the bigger priority and this is what I want you to address. And then I'll take
Hmm.
care of the other issues. Do you have any
Yeah,
stories like
so
that?
so something that really shows how that fascia is connected to
Yeah.
everything. Yeah. I mean, there's quite a bit, but one that comes to mind when you talk about that, I had a woman come in, and she was coming in for shoulder pain, neck pain, like the
Hmm.
typical TMJ, I clench, I grind, and I have headaches.
Yeah.
And within that first session, I did the thing. We did all the stuff, and we're helping open up those shoulders and things. But I'd got into her, those visceral organs, and really working around the
Hmm.
diaphragm and in her liver and all those places that I know these emotions sit,
Yep.
and finding those spots that really were bringing those reactions. And I could tell there was something here, right? So I just sit on those. We sit on those nodes, and we wait, and we see, and we comfort. And it comes to find, I mean, she came from a very abusive relationship. She had tons of religious trauma, and all these things were sitting deep inside her stomach
Hmm.
and in all these organs, right? And
Hmm.
from that moment on, the next session, we were working knees where her legs were broken. We worked her jaw where he punched her. We worked, all these different places. And she came in just for head stuff and had no
Right.
idea that this stuff was living in there,
Right.
like completely disassociated. And the way she described it after that first session was her whole left side of her body came back to her, that her
Cool.
vision no longer was up and to the right, that she could see midline. She felt like she had to learn how to walk again with that whole left side of her body. She had disassociated that whole side of her body due to the trauma,
Yeah.
and she had no idea that like this was going to be this big, kind of shift. And I tried to explain to her, well, that's fascia, right? It holds
Right.
on to all those things.
Right.
And as we open things up, we don't know how it's going to come out, right? Um, and I've seen
Abs
so many other different ways of, women with, really right-sided pelvic pain didn't even tell me about it. I worked the left side completely, right side completely resolved. And they text me and say, I don't know how it works because you didn't touch that side. I didn't tell you about that because I was afraid you were going to touch it and it hurts, but now it's gone, and it's gone, like 6 months
Yeah.
still gone. Like it's
Yeah.
completely resolved because the fascial tension is released, and
But
we see this in emotions with shoulders. Another woman's shoulder stuff, and it was an emotional release related to a death, and the shoulder's completely mobile now, right? There's
yes.
no clicking. It's just really impressive. The body was designed in such a way that it leaves me breathless. And when somebody says, "Can you help me?" I say, "Yes," because I know this can help with almost anything.
Oh my gosh, it's so cool. It leaves me in awe too. Like I'm like,
Yeah,
oh
it's
my
unbelievable.
gosh. Like I would I'm like I would never have been able to figure this out, with like even applying my logical doctor brain, like, oh, they're having
Sure.
this symptom, then this symptom. So textbook, it should be X, Y, and Z, right? And it's just like so fascinating. And when you share those stories, it's like what you're doing there, John, is you are honoring the body. You are not going symptom chasing. You're not on a
Mhm.
like wild goose chase to go after everything that they're walking in with, And a lot of times, like you said, they're not even sharing things that are going on. You're
Yeah.
finding them and bringing them up to them. And so many times, like that with patients as well, like what happened to you when you were 2 or 3 years old? What went on
Right.
in your life at these points? Like, how did you know that?
Yeah.
Well, I
Right.
didn't. Like, your body is telling me. Like, and that is
100%.
like the coolest thing because it's like, you can get the body back into a place of just like ease and function and health, like true health, not just a body without symptoms, a body without pain, but a body that's actually like working the way that it was designed to do. So, super incredible. Is there anything you would like to share that I haven't asked you?
No, I mean, not that I can think of. I don't know. I'm an open book. Ask away.
Yeah,
I love what I do.
yeah,
Being saved by Jesus, being a
yeah.
renewed follower of Christ has completely changed my life,
Yeah,
and that's a big part of everything I do now.
I
So,
love that.
and just being able to witness that and see those miracles and you know working in the spirit. Somebody
Yep,
referred to as prophetic fascial therapy. Like what I'm doing is prophetic fascial
I
therapy.
love
Like I'm
that.
getting in there, and
Yes.
again, I don't need to know what's going on, right?
Mm-hmm.
I can yield my hands and I'm
Yeah,
gonna find it. And
yeah,
and if I had a dollar for every time somebody said, "I didn't know I was tight there. How did you know?" And I can't explain it. It's not a superpower. I'm not this.
right?
It's the spirit working through me and showing me those things, right? Just like Isaiah, there was a voice calling in the wilderness. The wilderness was a barren, isolated place. And
Yeah,
sometimes our bodies and our spirits and our
yeah,
minds can become very barren and isolated. And we're going to
yes,
make way, right? We're making way because
yes,
we're coming back. And I
yes,
truly believe that physical body work, this
yeah,
fascial therapy,
yeah,
is a way of preparing the body, right? It's a way of not
yeah.
only healing physically and fixing the temple,
Mm-hmm.
but we're mending and fixing the spirit too, because we need to be ready when Christ comes back.
Yep.
And it's very likely we could see him come back. So it's
Yes.
real. Getting body work is not something that is vain. It's not
Right.
vanity. It's stewardship, right? He
Right.
gave us a body. It's our job to take care of it. It's not ours, it's his. So it's our job to make sure it's ready for when he wants it back.
Ah, so beautiful.
Yeah.
It's on loan. Our soul is in here on
Yep.
loan.
That's it.
So,
Everything you are, everything you have is because of him, and he'll take
yeah,
it back when he's ready.
it's
So
so
just make sure
true.
it's ready.
Yes. One last personal question. When did you get saved or when did you become a follower of Jesus?
So January 19th of this year, I was
Oh,
raised Catholic. I did the
oh,
whole, you know, I call it cafeteria. You just
yeah.
take this, accept it, don't ask
Yes.
questions. I was an altar server, and I tell people the story all the time. There was a great priest during a mass. I was setting up for the mass, and I said, "Father, I don't understand why I have to do any of this. Like, it doesn't make
Yeah.
sense to me. Like, God's not going to hear me if I talk to him anywhere else." And he was very nice, and he said, "You don't have to do anything. You can leave right now, John, and you're going to be okay. God loves you no matter what. You can go take a shower and talk to Jesus. He's going to hear you. You don't have to be here."
Wow.
And I appreciated it,
Yeah.
and I continued to be an altar server for a
Right.
while. And then, I just decided it was enough. Like I didn't agree with it anymore, and I walked away, and I completely walked away. And January 19th, I was on my way to an in-home, going to do this for somebody at their house,
Yeah.
and I was listening to this like YouTube video. At the time, didn't know it was a Bible study. I thought it was like this man that speaks business but through biblical principles.
Uh-huh.
And I'm going, I'm going to translate what he says. Like, I'll know that he means universe when he says God, like so naive. And I'm going as I'm driving, going, that's what I say. Well, that's what I say. And that's what I say. And I pulled over, not no, I pulled into a Baptist church and I went, I'm a Christian. I've been spreading the gospel, but I've been messing it up.
Wow.
I have been using all the wrong terms. And I literally fell to my knees. I
Wow.
apologized right then and there. And when I say things vanished, things that were troubling me for years just stopped, just
Oh
completely
my gosh.
stopped. Desires changed, everything just in a
Yeah.
heartbeat. And from that day on, I said, yes, this is it. I came home, I bought a Bible, I started reading the Bible,
Oh,
and
so good.
I started questioning everything. Can I do my job? How do I
Yep.
raise my children? What
Yep.
should I do about my marriage? And you
Yep.
just go to the Bible. You pray to God, you go
Yep.
to your Bible, and all the answers are right there. And it's amazing how it just happens. You know what I mean? The spirit
Yeah.
comes and it tells you exactly what to do, how to raise your kids, how to fix your marriage, how to be a better man, how to run your business.
So
It's
good.
just all right there, and there's no going back. You know what I mean? It's just that was enough for me in that moment, just seeing. It's just I don't know. I can't explain it. I don't have to, but it was quite
No.
amazing. And I tell
Yes.
people all the time, like, I pray that it happens for you because
Yeah.
in a snap of a fingers, my life
Mm.
changed completely. Everything I
Yeah.
thought, felt, believed just stopped. And yeah, it's unreal. It's the
Oh
best
my
thing that ever
gosh.
happened to me.
Thank you so much for sharing that. That is so
Yeah, you're welcome.
awesome. Oh my gosh. Yes, the encounters, the true encounters with Jesus, not
Mm,
the people getting stuck in religion and all of those kind of things, that I feel like is really sad to me. Like you were saying,
mhm.
even one of the patients who had a lot of religious trauma.
Yeah.
But really just allowing Jesus to come in and change your life, like allowing him to just like take, like you were saying, like you may not understand every word you're reading on the page, but like read it, allow God to speak through like through
Mm.
it, and so it's so beautiful. And wow. Okay, so I end the podcast with my podcast guest since this show is called Your Body Speaks. We know that
Yep.
the body speaks. It does not speak in the language we want to understand it in, like in English or in Spanish or it
Sure.
speaks in its own kind of way. I know fascia is like a huge communicator. I know that's what you do.
Yeah.
Can you think of some other way in which you know to be true that the body speaks? Like I'll give you an example. So one of the things I tell patients all the time is when you start sneezing, it's not allergy season, you're just walking along and you take a couple sneezes, one, two, maybe three. That's a sign that your immune system is kicking up. Like your immune system is like, "Oop, hey, this is not the time to put sugar in me. This is not the time to try to push your limits. This is the time to drink more water, get some rest, and stay away from all sugar, or you're going to be flat on your
Mm.
back." Like, hey, I'm notifying you. I'm putting you on
Yeah.
notice, right? And we dismiss it, dismiss it, dismiss it. Any other thing that you can think of that kind of where the body goes, hey, I'm trying to tell you something.
Yawns are a big sign of like a nervous system reset. You know what I mean? So
Good
if you're
one.
yawning, that's your nervous system trying to kick back in. Think of it as
Yep.
like shutting off, like hard reset anything.
Yep.
So if you're yawning, your nervous system is trying to catch up, you know? And if you
Yeah.
get that urge to shake or move, usually that's a lot of tension in the body. That's a lot of stress. It's just like animals when a gazelle gets chased down by a lion and the lion gets away, the gazelle gets up and shakes, right? We got to get rid of that extra, all that, cortisol, all that adrenaline
Yeah.
because it sits in us. And I mean, you can see this more in kids. When kids are running around acting crazy, let them. They need to get out, get them outside. They're trying to shake off all that extra stuff, you know?
So good.
Yeah.
So good. That's such a great one. Yes. All the shaking and getting the nervous system.
You gotta move it.
I find sometimes too, like, it's just like sometimes you just have to make sounds like, oh, like what, like moving stuff through
Vocalize,
your
yeah.
body. Yeah. So, so cool. Well, John, thank you so much for being on the show today. I'm going to put all your links in the show notes for people to connect with you. But if there's anything else you want to share, like last words, before we jump off.
Yeah, no, I really appreciate it. I think I put everything in there. I'm glad people check it out on Instagram. That's where I put most
Yeah.
of the content that I share. I am
Yeah.
launching a YouTube video where I'm going to be talking about faith and fascia, right? So the
Cool.
body healing, all the different modalities, all through the lens of faith. And those
Cool.
first video will be out next Saturday or this coming Saturday.
Okay.
So that's just, faith and fascia on YouTube. If you want to check that out, I'm excited to be launching that and really sharing more of this, right? More of the faith and the scripture behind the breath work, behind the body work,
Yes.
behind the healing,
Yes.
behind the mind body. So I'm really excited for that. And I appreciate you giving your time and inviting me on. It's been a lot of
Absolutely.
fun. Yeah, I just love
Yeah.
talking with people. If anyone ever has questions, if you're watching this and you want to know you have questions, reach out. You can either go through the website, contact, the email, Instagram, whatever it is. I'm happy to help as much as I can.
Awesome. Yes. Thank you so much. And Instagram is the way that we connected. So thank you,
Yeah.
Instagram algorithm, for actually working in a favorable way.
That's right.
So awesome. Thank you all. And we will see you on
Cool.
next episode.
All
Bye.
right. Bye.